told me that I would probably be dead by the time I was 50.
I thought, no, this is not possible.
I noticed the bumps on my forehead. It didn't look like anything I had ever seen before.
It was obvious that she was in immense pain.
I was afraid things would be pretty grim for Pam's future.
Next, two medical mysteries that defied the experts. Karen Tickle always knew that she was different.
From the time I was 9, I would have intense stomach pains and diarrhea that was bloody.
Little does anyone know she's living with a potentially deadly disease.
I was really scared that I might die.
Then, Pam Donner suddenly finds her joints locking up when she least expects it, and bizarre growths emerging on her body.
I knew there was something seriously wrong with me. I just needed to know what is attacking me.
From the moment Karen Tickle was born in a North Carolina farmhouse in 1964, her parents, Jim and Margaret, knew she was special.
I was born with albinism.
All the other children had dark hair, and hers was just as white as it could be. The doctors told me that being an albino made her very sensitive to the sunlight.
When I was a baby, my mom had to buy these little sunglasses because the sun was so bright and it hurt my eyes.
And it's not long before her parents observed something else different about their little girl.
At 3 months old, I began to notice it. She didn't seem to see anything. I knew something was very wrong, so we went straight to the doctor's office. They diagnosed her as legally blind.
Even with the most powerful corrective lenses, most legally blind patients can't see anything more than 20 feet away.
Around age 3 is when I got my first pair of real glasses. They were a little tinted and quite thick. I thought it was pretty cool because I was the only one in the family that had them. At home, I was just part of the family. I never thought I was really that different from other kids until I went to school. Kids at school were not really very nice. They didn't like to play with me that much. I never really said a whole lot to my parents about what went on. I've always been the type of person to just try to handle it on my own.
Despite being teased about her unusual appearance, Karen is a happy child, excelling all through elementary school.
I was a very good student. I was the top of my class.
Then one day, soon after her 9th birthday, Karen is playing outside when she's suddenly hit by a wrenching pain in her abdomen.
At first, Mama thought that it was just a stomach ache. She just gave me some type of stomach remedy.
But over the next 48 hours, the cramps intensify.
The pains would become increasingly stronger, and by this point, I started having runny diarrhea, fevers. I was going to the bathroom a tremendous amount for a little girl.
Her parents have no idea how sick Karen is until they check on her in the bathroom and see blood in the toilet.
She was trying to have a bowel movement and started bleeding so bad that we knew we had to do something, so we carried her into the hospital.
When we got to the hospital, I was terribly afraid. They took all my information, and the doctor had ordered some blood draws. They ordered tests of my entire digestive system, all the way from the esophagus down to the rectal area. The doctors decided that I had Crohn's disease.
Crohn's disease is a chronic condition in which the walls of the colon or lower intestine become inflamed. This causes diarrhea, acute pain, and often leads to bleeding sores, also known as ulcers, on the intestinal walls.
They found bleeding ulcers. They put me on steroids to get rid of the ulcers, and then they put me on a maintenance drug to try to keep it under control.
But while Karen dutifully takes her medications, the Crohn's symptoms continue to flare up.
From the time I was 9 until the age of 13, it's really a blur. Once every 3 to 6 months, I would have intense stomach pains and diarrhea that was bloody. It's indescribable what those pains were like. They were so severe.
Karen does her best to get through each attack. But one Saturday, when she's 13, things take a terrifying turn for the worse.
I had gone to the bathroom all day long. There was bright red blood in the stool. I had lost so much blood. When Mom got home from work, I said, I feel bad. Can I go take a bath? As I was laying in the bathtub, my heart started to pound like it was going to come up through my throat. I noticed blood in the water. I knew this was not right. As I stepped out of the bathtub, I thought I was passing out, and my vision became dark. And at that point, Mom comes in. She took one look at me and had somebody go and find my daddy.
We got Karen into the car and we rushed to the hospital. I just knew we had to get her to the doctor.
When I got to the hospital, they got me into the treatment room. I remember I was scared.
20 minutes later, an ER doctor informs the family that Karen has lost a tremendous amount of blood, and her blood pressure is now dangerously low.
They transfused approximately 4 units of blood that night. They found what appeared to be bleeding ulcers. They believed that the bleeding was from the Crohn's disease.
Karen's hemorrhaging so severely that her medical team is forced to make a radical recommendation.
The doctors told us that Karen's complete lower intestine was just diseased and that there was no other way except to completely get rid of her lower intestine. I was shocked.
The surgeon will have to perform an ileostomy, a procedure in which the large intestine, which is made up of the colon and the rectum, is removed, and a pouch is attached to the abdomen to collect waste.
The colon is where the body stores the feces. So what would happen is it would drain into the ostomy bag, and you would take it to the bathroom and empty it. It was humiliating, especially for a 13-year-old. And I was concerned how my life would be in the future with dating and having children. It was extremely difficult to cope with it all.
"13-year-old Karen Tickle has just been admitted to the hospital after bleeding intestinal ulcers have left her barely conscious on the bathroom floor.
I had never had the feeling of passing out. I had never had my heart feel like it was going to jump into my throat.
Now, doctors are concerned she might not survive another attack of Crohn's disease, the horrifying intestinal condition she's been battling since she was 9. Unfortunately, the only way to keep the disorder from killing Karen is to cut out her large intestine entirely. It means she'll have to wear an ostomy bag to collect waste for the rest of her life.
Since they said that was the only solution, we just accepted it and went ahead and had it done.
I think it was a tough decision for them to make. I think they felt it was their only choice because they felt I might not live to make it to the hospital the next time. I remember laying in the bed and Mom was sitting beside of me. I started to cry. I could tell that upset Mama because she goes, "Are you okay? Are you okay?" And I said, "Oh yeah, I'm fine," because I didn't want her to be upset. It was always important for me to be brave.
That night, Karen is wheeled into surgery as her anxious parents look on.
I just remember feeling that I was tired of hurting. I wanted to get better.
Naturally, I worried the whole time she was back there.
6 long hours later, the surgeon pronounces the operation a success.
I remember probably about a week after surgery feeling better, much, much better. Not having any pain, no more diarrhea was liberating. It was awesome not to be sick.
Relieved to finally feel healthy after enduring so many years of pain, Karen adjusts to the ostomy bag with remarkable ease.
It really didn't take long to get used to it.
If she didn't tell you she was wearing a bag, you wouldn't know it.
Over the next 4 years, I felt like I was just a normal girl.
Thrilled with her newfound freedom from the insufferable symptoms, Karen throws herself into the high school social scene and graduates with honors.
I was excited to start college, but on the other hand, I was scared to leave home.
Well, it's always been hard with all my children to let them go from home, but it was harder to let her go.
Karen soon settles into college life, and in the spring of 1983, the 19-year-old meets a man who sweeps her off her feet.
Tommy was, of course, he was cute.
What attracted me to Karen was the fact that she was very bubbly and very fun to be around.
Things get serious quickly, and Karen finds herself facing an awkward dilemma.
The hardest part about having an ostomy and dating is you have a fine line. When do you tell this person you have an ostomy? Tommy and I had been dating probably a few weeks.
I had noticed on her wrist she had a bracelet, so I asked her what this was, and she said it was a medical alert bracelet.
I explained that I have to wear this little bag on my side, and then I took his hand and I placed it on my stomach so that he would know where it was at.
And I sort of thought, this is different. I thought to myself, what the heck, she's still real nice, you know. It was a bonding experience in a way.
Closer than ever, Karen and Tommy continue to date throughout college. And almost as soon as Karen finishes school, they get married.
As I got ready to walk down the aisle, I was not nervous because I knew that he was who I wanted to spend the rest of my life with.
And within the year, the young couple learns that Karen is pregnant.
My pregnancy was probably the healthiest I've been in my entire life. I had a very good, uneventful pregnancy.
On August 27th, 1988, Karen gives birth to a healthy baby girl who they name Holly.
I was like the proud mama, and Tommy was like the proud papa.
When Holly was born, it was just fantastic. I was just jumping around the place, dancing around with the nurses. It was great. We enjoyed life as a regular family. She was doing a great job watching after Holly.
At this point, we had a good family life. I had years of really good health.
As time passes, Karen begins to feel that her medical problems are a thing of the past. Then, out of the blue, she receives a startling voice message in the fall of 2002.
It said, "Karen, you don't know who I am, but I'm related to you, and I have a son who has albinism and Crohn's disease." And she proceeded to tell me that her son, my cousin, had a rare genetic disorder. They felt I needed to see a doctor and get tested, because if I had this disease, it was a real possibility that I might die. I didn't understand what was going on.
Since she had her colon removed 25 years ago, Karen Tillman has been wearing an ostomy bag that seems to have essentially cured her of the intestinal disorder Crohn's disease. But now, she's been told she may have an extremely rare and potentially life-threatening condition. Terrified, Karen calls Laura Lomax, her friend and personal doctor of many years.
I said, "Look, my cousin says that he has this disease. Is this a real disease?" Dr. Lomax said, "I don't really know if it's real, but I'll go and look it up. I went and consulted a textbook, and Karen matched up with the symptoms quite well.
To be doubly certain, she reaches out to Dr. Samuel Seward, an expert in this highly unusual disease.
Karen had the albinism and the bleeding in the intestines that caused the symptoms like the severe abdominal pain, diarrhea that can be so bad that it's really disabling.
I thought she should be tested for this, and we drew the blood and sent it off. Waiting on the results of the blood test, I wondered, what now? What's going to lie ahead? And then after a week, Karen came into the office and I had the lab test back. She actually had Hermansky-Pudlak syndrome.
Hermansky-Pudlak syndrome, or HPS, is an extremely rare genetic disease. In healthy individuals, proteins act as the building blocks for virtually every function of the body, including vision, digestion, and respiration. But in patients like Karen, the proteins malfunction, impairing the body's ability to see, process foods, and breathe.
Any patient with a genetic mutation like HPS, proteins are not created normally and cause problems. Hermansky-Pudlak syndrome affects different organs of the body. It's really a terrible disease.
HPS is a complex condition, but its first symptom, albinism, is hard to miss.
If you have HPS, then you have albinism. Patients with HPS can make pigment, which we call melanin, but they can't get the pigment where it needs to be. It's not packaged correctly and transported to our skin or to our hair or to our eyes as it should be normally.
Most of the patients are legally blind.
While Karen adjusted easily to living with poor eyesight, the bowel problems that first plagued her when she was 9 years old were also triggered by HPS.
About 20% will develop what we call inflammatory bowel disease or a colitis. When you have inflammation in HPS colitis, the inflammation can be so severe that the intestines really can't work very well. And that's what causes the diarrhea.
Some people with HPS develop a colitis similar to Crohn's disease, but it's the colitis of HPS.
Karen's intestinal problems were especially severe because HPS not only caused her bleeding ulcers, but clotting problems as well.
In healthy individuals, our platelets clot our blood when we have an injury. HPS patients have a problem with their platelets. So as a result, it takes them much longer to create a clot and stop the flow of blood. So the HPS colitis causes the bleeding ulcers. And because of this basic platelet abnormality, the bleeding can be quite profound. It's absolutely the case that internal injuries can result in very serious bleeding for someone with HPS.
While Karen has been able to manage all of the unfortunate symptoms that go hand in hand with the disease, there is one remaining symptom that may prove to be fatal.
Most people with HPS will develop pulmonary fibrosis at some point in their lives. Pulmonary fibrosis is a chronic lung disease. If you imagine the tissue in the lungs being like a very thin membrane, and that's what the oxygen passes through, that membrane gets thicker and thicker to a point where oxygen can't even pass through it anymore, and the lungs can't function. Those with HPS and pulmonary fibrosis, their normal life expectancy is 4 to 10 years after they're diagnosed.
At first, I thought that, no, this is not possible.
I was really, for the first time, scared that I might die.
"38-year-old Karen Tillman has just learned she's been living with HPS, an extremely rare genetic disorder. Even more troubling is that as it advances, almost all patients develop pulmonary fibrosis, a terminal lung disease.
Unfortunately, there's no cure for Hermansky-Pudlak syndrome or pulmonary fibrosis.
Just 3 months after getting a diagnosis, Karen is told she is in the early stages of the condition.
When I was first diagnosed with the pulmonary fibrosis issue of HPS, they told me that I would probably be on oxygen by the time I was 45 and dead by the time I was 50. And I didn't want to scare Holly, but I wanted to prepare her somehow. So we sat down and I told her, I said, someday I might have to go on a ventilator. She reached over and she said, Mom, it's going to all be okay. It's one of those things you just don't dwell on. I figure the more normal I can live my life, the more normal she can live hers.
Despite the overwhelming grief that comes with having pulmonary fibrosis, there are medications that can slow down the disease.
For people that have HPS who are dealing with pulmonary fibrosis, I believe early diagnosis is very helpful. There are lots of different treatment options available.
Karen immediately starts using inhalers to minimize the inflammation of her lungs. And as terrible as the condition is, she's grateful to have received a diagnosis in time to begin treatment when it can still make a difference.
There are things that people can do to take care of themselves who have early pulmonary fibrosis. Exercise and getting vaccines that particularly protect the lungs is very important.
But given how serious her disease is, Karen finds it hard to understand why no doctor was able to recognize that she's been living with a deadly condition since the day she was born.
Hermansky-Pudlak syndrome is quite rare. I think I've seen about 40 to 50 cases of Hermansky-Pudlak syndrome in my career.
This was very upsetting, and so you just try to take your mind off of best you can and talk to her and reassure her that it's going to be okay.
Today, nearly 8 years after getting diagnosed, Karen Tillman is miraculously beating the odds.
Karen today is holding steady on her pulmonary fibrosis.
So far, it's been stable since I was 38. There's only been mild progression.
Some patients faced with a difficult and chronic disease become very bitter over the years. And Karen, despite the rotten hand of cards health-wise that she's been dealt, she rises above it.
Karen has dealt with the problems she's had better than anybody I know. She just seemed to accept what she had and has done the best she can with it.
The experience as a whole has bonded us even closer together, knowing that we are mortal, that we only have a limited amount of time. You have to live each day because you don't have any guarantee of tomorrow.
Tommy is my rock. And I could not have made it through this journey without him. We just take it a day at a time. I'd like to see my daughter get married and be happy. I'd like to see my grandchildren born. I'd like to get a new set of lungs someday. We live and appreciate every moment that we have to get to spend together. It's cherished probably more than the average person.
While Karen Tillman was born with a disease that presented its symptoms at birth, it took more than 40 years before Pam Partington's body began to mysteriously attack itself. In the fall of 1998, Pam Partington was focused on one thing alone: teaching her special needs students.
I love to see kids succeed. I love to help kids to feel good about themselves and to feel confident.
And soon after celebrating her 34th birthday, she met Christian Donner, an Austrian who shared Pam's love of the outdoors.
When I met Pam, she was a very active person. We went for hikes in the mountains of New Hampshire.
We did a lot of traveling, and it was really fun. We both were ready to settle down.
And on July 21st, 2000, Pam and Christian tie the knot. Almost immediately, they begin thinking about having children.
We always wanted to have a family together. That was on the table from day one.
We didn't waste any time because of our ages. And it didn't take long for me to get pregnant. I was very excited because I always wanted to be a mom.
Pam's pregnancy goes off without a hitch. And 9 months later, the couple welcomes their son, Lucas, into the world.
I just fell in love with him as soon as I saw his face. I got pregnant soon after with Sophie.
Sophie was a little blonde bundle. Her little brother Lucas, of course, doted on her, as did Christian and Pam.
I could not wish for a better wife and mother. I just marvel when I watch the amount of patience that she has with the kids.
Despite having a full-time job and 2 toddlers, Pam juggles work and family with ease. In fact, life couldn't be better. But one morning, in the fall of 2004, she notices an odd sensation in her right hand.
I was trying to write some notes on my dry erase board. I was having trouble with my hand. My fingers really were getting very stiff. And I noticed the sharpest zing right down my hand up into my wrist.
She said it was like a stabbing pain, and her fingers were almost becoming immobile.
When I got home, I took some ibuprofen.
While the medication takes the edge off the pain that night, over the next few weeks, the strange ache returns whenever she uses her hand.
It hurt, but it was quick pain, and I didn't think that it was anything too serious.
But soon, the pain is affecting both of Pam's hands, and simple everyday tasks are starting to become impossible to complete.
I noticed that trying to carry the grocery bags, I would have to drape them over my arm to carry them into the house because I just couldn't rely on my hands.
She would just leave them or just come up and ask me to help her.
When I was at work, if I tried to pick up a book and hold it with my fingers, I would drop it.
As her friend, I was becoming more concerned that what was wrong with her could be quite serious.
Christian, his response was, well, you need to make an appointment with a doctor. My primary care physician referred me to see an orthopedic doctor. The orthopedic doctor said, well, I think it's carpal tunnel.
Carpal tunnel syndrome is a condition in which repeated pressure on a nerve in the wrist causes pain or weakness. In severe cases, patients become unable to use their hands at all, and surgery becomes necessary.
He did a test for carpal tunnel. At that point, the orthopedic doctor told me that he didn't see any evidence of carpal tunnel, and there wasn't much that he could do. So I tried to use my hands less in hopes that the situation would improve. But as time progressed, things just seemed to get worse.
Just holding her hand would cause her pain.
Strangely, as the weeks pass, the debilitating aches intensify. Frightened, Pam schedules an appointment with a local rheumatologist.
It was very frustrating. I needed to know what was wrong. The rheumatologist ordered several tests for me. I had to go for blood work to see if I had rheumatoid arthritis because he thought that might be it.
Rheumatoid arthritis is a chronic disease that causes inflammation of the joints and, in the worst cases, can damage the heart and lungs.
I was worried about our future and not knowing if Pam might have a really serious disease.
I knew there was something seriously wrong with me, and I was so upset. I just needed to know what is attacking me.
Over the past 9 months, Pam Donner has been enduring crippling pain in her hands. And no doctor can explain why. Now, a specialist suspects that she's suffering from rheumatoid arthritis.
While I was waiting for the results, it was difficult to be patient. You look at the worst case scenario. It was really starting to get me to worry too much. When I received the results, I had Tested negative for rheumatoid arthritis. I was relieved, but I was really starting to get pretty upset not knowing what it was.
Then, just a few weeks later, things take a frightening turn for the worse, forcing Pam to realize just how serious the problem is.
I had just arrived at work. I received a call from Christian saying that Sophie had fallen at daycare and needed stitches. I went out the doors and I tried to run to my car, and I could not bend my knees enough to run. It was really painful. My knee was really swollen, and it was such an awful moment because I knew I needed to get to her as fast as I could, and I couldn't do what I needed to do. That really was the toughest part of it. At this point, I was so overwhelmed.
At the end of her rope, Pam returns to the rheumatologist demanding answers.
When I met with the rheumatologist, he performed different movements with my legs to see how far I could move them comfortably. When he asked me to make a fist, I couldn't really make a fist anymore. The rheumatologist was concerned that I might have lupus.
Lupus is a debilitating autoimmune disease that causes chronic inflammation and pain in the joints, skin, kidneys, lungs, and heart.
I had to go for blood work, and I was very worried.
I thought that if, in fact, that was her diagnosis, things would be pretty grim for Pam's future.
The next 2 days pass in slow motion as Pam and Christian anxiously wait for the results.
The test came back negative. It was a relief, and then it was not, because we didn't know what it was.
Not sure where else to turn for answers, Pam heads home and does the best she can to simply get through each day.
It was obvious that Pam was in immense pain just by watching her around the house.
I was struggling to walk upstairs. I couldn't kneel down to help give the kids a bath. I couldn't play with the kids on the ground because kneeling was so painful.
When I taught Lucas how to ride a bike, that was not something Pam could do. She was upset about not being able to run around with them, and the kids didn't understand that.
It was very, very frustrating, and I was depressed.
Bit by bit, Pam feels like a mysterious disease is slowly destroying her life. And then, to make matters worse, a bizarre new symptom suddenly emerges.
I noticed the bumps on my forehead, and they were very hard. It didn't look like acne. It didn't look like anything I had ever seen before.
I thought at the time that it was caused by stress, because we certainly had a lot of stress.
But soon, the strange bumps begin spreading to other parts of her body.
I had on my hands large nodules, probably a good 10. There were several around the neckline. They were very noticeable.
The bumps looked wart-like. They were a reddish, brownish color. I was totally perplexed by what was happening.
So I made an appointment with a dermatologist, and she told me that I had granuloma annulare.
Granuloma annulare is a benign skin condition which usually lasts only a year or two. Its cause is unknown.
The doctor told me that she could treat it with some prescription ointments and the nodules would go away. And I said, well, but what about the joint pain I've been having? And she said to me, I don't know, I have no idea. It was very, very frustrating. The antibiotic ointment and creams I used twice a day faithfully, and I didn't notice any improvement at all.
Pam was self-conscious about those bumps. She would try to cover them with makeup. She would be careful about what she would wear, how long her sleeves were so that they would be covered.
I knew that my health was deteriorating quickly, and I knew that I needed to find out what was causing this. I was really scared.
Over the past 2 years, debilitating pain and swelling that seemed to defy diagnosis have turned Pam Donner's life into a living nightmare. And now she's developed more than 30 inexplicable nodules on her body and is in a desperate search for answers.
I I went to the rheumatologist again. He didn't know what was causing the joint pain, but because the bumps were showing no signs of going away or improving, he asked me if I minded seeing a new dermatologist. I thought it was a good idea. I showed her the nodules on my forehead, behind my ears, on my hands. I also described the joint pain and the knee problems that I was having. I told her that I felt very inflamed and very swollen, and I was so stiff.
In that moment, the doctor suspects she knows what may be causing all of Pam's seemingly unrelated symptoms. But first, she must confirm her hunch.
She immediately biopsied my hand, and she also did a repeat biopsy of my forehead. The slides were sent to pathology, and Dr. Zimorowski viewed the slides.
When I received Pam's specimen and looked at it under the microscope, I was really struck to see these very large cells in the dermis. And there's only a few disorders that can actually cause that accumulation of those large cells in the skin. And when I looked at her chart, I found that she actually did have a number of complaints of joint pain. So that suggested that they were all related with the same diagnosis, multicentric reticular histiocytosis, or MRH.
Multicentric reticulohistiocytosis, or MRH, is an extremely rare disease. In healthy individuals, histiocytes, a type of immune cell, remove toxins and release chemical agents called cytokines, which play an important role in inflammatory processes and bone growth. But in patients like Pam, the body produces too many histiocytes, which in turn send out a disproportionate amount of cytokines, ultimately attacking the joints.
The cause of MRH is unknown, but somehow in the skin there's a proliferation of these large histiocytes. The problem is with the increase of histiocytes, there's too much release of cytokines, which then eat away slowly at the joints. So in patients with MRH, they'll have erosions of their bones.
Dr. Zimorowski is like my guardian angel. She just looked at my slides, she looked at reports, and she figured it out.
While the triggers for MRH are unknown, the disease has a typical trajectory, which it followed to the T in Pam's case.
MRH is more common in women, and usually it occurs in patients in their 40s and 50s. Most commonly, it affects their distal finger joints, and there also may be histiocytes within the joint fluid, which can cause swelling in their joints, which become painful and will cause limited range of motion. They also can start to develop similar pain within the knees.
As the disease attacked more of Pam's joints, the pain intensified, and her range of motion gradually decreased. And the peculiar skin nodules, far from being an unrelated symptom, were actually an essential clue to her diagnosis.
In MRH, the histiocytes within the skin cause an aggregation of cells, which then raises the skin to form a reddish-brown nodule.
It made sense. I had something that was causing damage rapidly to my joints, causing inflammation. It was present in my skin. I was very relieved to have a label, and I was overwhelmed all at once.
But it's the next potential stage of the disease that terrifies Pam the most.
In MRH, about 25% of patients may develop a malignant tumor.
What broke me was the risk of cancer. When I realized that I might have cancer, I was very, very worried. I just knew I needed to quickly set up the appointments for the testing.
Pam developing cancer and becoming terminally ill. That's something that I pushed out of my thoughts as much as I could. I was scared and I was worried. I did not know what our life was going to turn to.
The more common tumors that may develop in MRH are breast carcinoma or stomach carcinoma.
I really had to dig deep and focus on the positive.
The following week, Pam undergoes a series of tests to determine if she has any of the cancers caused by MRH.
Waiting for the results of the test and the screening for cancer was a challenge. If I had cancer and I had passed away, I felt Christian could handle it. But I wanted to be there to take care of the kids. When I did get the results of the scan, I was so grateful that they didn't find cancer. I felt like I dodged that bullet.
It's now all too clear that Pam was lucky to have received a diagnosis when she did.
If Pam remained undiagnosed, the MRH would progress, and the worst complication of that is severe destruction of joints.
Dr. Zimorowski, I believe, really saved my life.
And fortunately, while there is no cure, there are effective therapies for MRH.
Pam's treatment options include an autoimmune suppressant to help decrease the number of histiocytes that are proliferating. Oral steroids can also be helpful with anti-inflammatory function, and ibuprofen can help for the actual joint pain and inflammation.
In fact, it's even possible that one day Pam may be symptom-free.
MRH patients may undergo remission at about 8 years. If patients do undergo remission, their skin lesions will resolve. The joints will not get worse, but any joint destruction that has already happened will persist.
I was very hopeful that I could go into remission in 5 to 10 years.
While Pam is relieved and hopeful about the future, she can't help but wonder why it was so difficult to get a solid diagnosis.
MRH is an extremely rare disease. Pam's case is the first case of MRH I have diagnosed. And there's only 200 cases reported in the world. And MRH can mimic a number of different disorders that may cause arthritis and skin lesions.
I feel very grateful to Dr. Zimorowski that she put the puzzle pieces together.
Today, Pam is living an active, healthy, and very full life.
I'm doing great.
I think Pam's in remarkable shape. She has less pain.
She can ride bikes again. So that was something that would have been unthinkable only a couple years ago. And I'm optimistic about our future.
I try to spend as much time as I can with my family. This experience has brought us closer together. It's strengthened me personally because I appreciate every moment I have.